dear Lord. May we also remember that you are our Creator and you are the great physician, that all and any maladies that we know of, Lord, you are the answer and you are the solution. Now be with us as we discuss. In Jesus' name we pray. Amen. So, what is hypertension? It's high blood pressure. And what is high blood pressure? Okay, so this is when the force with which the blood is pumping around the body is higher than usual or higher. And most of the time, the cause is not known. It just happens. So 90% of the time, hypertension, nobody can tell what has caused it. And we call it primary hypertension or essential hypertension. But in a few cases, 10%, then you can find a cause. You can maybe relate it to some other abnormality causing the hypertension. But what we know is when the force with which the blood is pumping around the body is high, then it can be associated with a lot of problems. Number one, you can imagine like a water pipe. Okay. If the pressure in the water is very high, what happens? It's pushing against the arteries, the walls of the vessels. A normal artery is normally elastic, pliable, so it can expand when the heart is pumping and relax. But when the force is too much, the walls of the artery become stiff, they become thickened, something called plaque develops. So this is like fatty tissue with deposits and cholesterol forms to stiffen the wall of the artery, and then it narrows. It makes the lumen of the arteries to be narrow. Okay, so that happens over a long time. So, in some instances, the pressure can force a weakness. It can find a weakness on one side of the artery. And because of that, it will bulge. The weak side will bulge. And that is what we call aneurysm. Now, aneurysm is very dangerous. I'll give you, and I'll relate one case of a patient that I handled. So an aneurysm is when the wall of the artery bulges out, and when because it's a point and the blood is under a lot of pressure, what can happen to an aneurysm? Yes. So the artery that takes blood from the heart to the body, the big artery is called aorta. And it comes from the heart and it sort of folds in the chest as it starts to branch. So the descending aorta is the one that most often develops this aneurysm. So you are very much okay, you are very healthy, and then all of a sudden you might feel a chest pain. And then when you go to the hospital, they might take a lot of investigations, scans, and they find it. And it's usually caused by high blood pressure. So the patient that I had this aneurysm, and it started to split the artery, so you could see that it was soon going to burst. And this patient was taken to Aga Khan. Okay, actually it's the friend who called me and said, we have a patient in Aga Khan, please talk to the doctors. And then I spoke to the cardiologist, and they had brought the cardiothoracic surgeons. And when they did all the measurements, they said, this is a dissecting aneurysm, it's likely to burst. Okay, what can be done? Remember, this is a big artery. So no surgeons in Kenya were willing or able to do that surgery because of how delicate it was. So then we had to get AMREF and fly the patient to South Africa, Sunning Hill Hospital, and they tried their best. They were able to do the surgery. Patient went to ICU, unfortunately. After 1 week, the patient didn't make it. So high blood pressure can cause aneurysm. Another thing, because of the pressure and the possibility of bulging, it can cause a stroke in the brain. So a stroke is when blood supply to one part of the brain is blocked, either because of a clot. You know, the plaque I was talking about, it can be loose, and then it causes a clot and blocks the artery. Or the artery can burst and bleed. So the end result is lack of blood supply to that part of the brain. What happens? You get suddenly, out of no warning, weakness of the face, one side of the face, sometimes also one arm or even the leg. It can also affect the level of consciousness. So someone might faint, okay, or go into coma, or just become confused. It also can affect the speech, depending on which side of the brain is affected. So the speech can become slurred. Someone knows what they want to say, but they cannot vocalize it, okay? So a stroke can be a result of the high blood pressure, hypertension. At the same time, because of the high blood pressure, sometimes the vessels that supply the brain, because they're becoming narrow with the time, someone can get what is called dementia. So dementia is something that comes slowly, gradually. You forget things, you forget few things, okay? Because the brain needs a good supply of blood to be able to utilize the glucose, to think, to be sharp, to respond. But you can imagine when the arteries are becoming narrow, the blood supply is reduced, so you begin to forget. Or if someone is in a high performance industry, their performance begin to drop gradually over time. High blood pressure can also affect the eyes. The same thing. The arteries that supply blood to the light-sensitive layer of the eye, the retina, when the blood supply is not adequate, it can cause blurred vision or even blindness in the eyes. Coming down, in the heart, two things may happen because of high blood pressure. The most common one, the arteries that supply the heart, they're called coronary arteries. Because of that thickening and narrowing of the vessels, there is reduced blood supply to the heart. What happens? The coronary artery might get blocked, And that portion of the heart muscle that needs blood to pump, it dies. Depending on how big the muscle that dies is what we call a heart attack, because the heart can stop to function. So that is very common. Actually, young people between the ages of 40, 50, 60s, we are getting a lot of heart attack cases nowadays. But gradually also, the fact that in high blood pressure, the heart is working overtime. So the heart muscle, for those who go to the gym, when you pump, what happens to your biceps? Right? They become bigger. So the heart is pumping over time, so it becomes bigger. We call that cardiomegaly. So a bigger heart, unfortunately, is not efficient because it's too big. So it's not efficient. It is overworked. So that leads to something we call heart failure. Now, in heart failure is something that comes gradually, and the heart is not able to pump efficiently. So when you want to climb the stairs, you feel breathless. You cannot climb fast the way you used to. Or when you lie down, you feel you cannot breathe. Now you have to use many pillows so that you can be able to breathe. Maybe even your feet begin to swell because of water retention. So that is called heart failure. It can also result from high blood pressure. Going down, even the kidneys. The kidneys, the function is to make urine, which is really to clean the blood of the toxins. But you find high blood pressure will affect those arteries that are taking blood to the glomerulus, the place in the kidney where the filtration is happening. And that makes the kidney inefficient, which then leads to kidney failure. In the other arteries, you can also find a blockage, which can lead to something called, for the legs, something called claudication. So when you're walking, after a while, you feel pain or cramp and you have to stop because the blood supply to the legs has been affected. So really, there's no part of the body that may be spared from high blood pressure. The funny thing is that before any of these complications happen, you cannot even know whether you have high blood pressure or you don't, unless you go and check it. And these complications, they take long before they come. So, what is my message? It's always good to do a screening, because high blood pressure is a risk factor. You can control it, and then these complications are minimized. How do we treat high blood pressure? Most of the time, because you cannot identify the cause. In 90% of the cases, you can't identify the cause. If you can know the cause, then you just sort out the cause and you solve it. But 90% you don't know. There are some factors that you can say, okay, maybe the family, genetic, the father or the uncle or the grandfather, they had high blood pressure. Then age, so the older you grow, the more likely to have high blood pressure. Then also sometimes a diet that is using a lot of salt in the food, okay? But really these are just factors that can be associated, okay? But once we know that the pressure is there, some of those factors, they can be adjusted. So, for example, you can reduce the salt in the diet, you can reduce the fats and oils to manage the cholesterol, and you can increase physical activity, exercise, so that the body is well toned. But ultimately, there are medicines, pills, that can be used also to lower pressure. Okay, the normal blood pressure is 130 up to 135/80. By the time your pressure goes to 140, it's borderline, you need to be careful. 145 upwards, really you need to control it. Okay? So the medications, there are very many types, very many different classes of medicines for pressure. And depending on the level, if the pressure is very high, the doctor might even use 2 pills to control the pressure. Some of the pills are combined, mixed to form 1 tablet, so that the doses are lower and you don't have a lot of side effects. But the message for today is high blood pressure, and this came from the Amimo. They wanted a talk on this. High blood pressure is a well-recognized medical risk factor that, if left uncontrolled, will certainly lead to a lot of complications. So many people, when they come to me and they say, okay, Doctor, check my pressure, and it's high. But am I going to live on pills for the rest of my life? This is what most people are asking. Am I going to live on what? On pills. But I also say that if I have to take ugali every day, and that is food, isn't it? Yes. That food is helping me to get energy to do my work and to live. And now I have high blood pressure. Then it's important also that I control the pressure. I don't know if there are any questions, because we only had 20 minutes, and today has been a very beautiful day. We just mentioning about the high blood pressure. It is something that is with us. The other time when we had another health talk, we realized that cardiovascular disease is the top number 1 cause of death. And high blood pressure actually is one of the risk factors that leads to cardiovascular disease. That is the number 1 leading cause of death before you get even to cancer and the other diseases. It's very common. 1 out of 4 adults have high blood pressure. So if we are now, like here, if we are 200, no, we are probably 400 of us, so 100 have high blood pressure. The challenge is that some of us, we don't even know our blood pressure. And yet, you can get it checked in any chemist, dispensary, or a clinic or hospital. Even you can, nowadays we have even the digital machines, very cheap, you can buy and check by yourself at home. A lot of our own parents and relatives up country, they have never checked their blood pressure. So this is a message that you can also share, that everybody needs to have at least blood pressure check every year. Okay, any question?